Hello guys, coming to the next portion, that is a lab work infection control. So ADA and International Dental Federation insist on disinfecting all impressions taken from the patient before pouring or before transporting it to the lab to prevent cross contamination directly from the patient to the lab personnel. So how to disinfect impression? So once you have taken impression, you have to hold it below the tap water to remove the saliva and the debris, whatever debris and saliva is present on the impression. But studies have shown that you cannot remove more than 40% of contaminant from impression while holding below the tap water, and that is the reason we have to disinfect it with the proper chemicals before pouring and before transporting it to the lab. If you pour it without disinfecting that impression, then you can consider disinfection of your dental cast, but then again there will be a chances of damage to the dimensions of the cast because of disinfection procedure. So it is recommended to disinfect impression rather than the cast. So now how to disinfect dental impression? There are two techniques by which we can disinfect our impressions. The one is a deep technique, means you can dip your impression into the disinfectant solution, or you can use a spray for that purpose. So if you are using a disinfectant spray for disinfection of the impression, there are chances that spray will create a aerosol into the environment, as well as some areas will not get reached by that disinfectant solution. So then whether we should use a dip technique or not. So if you are using a dip technique, then again there are chances there will be the absorption of liquid inside the impression, and then there will be changes in the dimension of impression. So we have to use a spray technique, and for that you can use any disinfectant that you are using in your dental clinic. Even the best solution to use is 5.25% sodium hypochlorite solution in 1:10 dilution. So you have to spray your impression with this solution with a recommended dilution, and you have to close it into the polythene bag. So put it in the polythene bag after spraying, and close it with the help of rubber band. Keep it for, so pack that polythene bag and keep it for keep it not more than 10 minutes, because again it will going to change your dimension. And then you can wash the impression again, and you can pour it with the stone or plaster. But if you want to disinfect dental cast, which is a recommended solution, again here you can use 5.25% sodium hypochlorite solution in 1:10 dilution for a 30-minute time. So what about disinfection of prosthesis before cementation into the patient's mouth, or if you are using, or if you are going to deliver a dentures, then how to disinfect those parts? So it is not recommended to disinfect with high level or other disinfectant. This is because there will be a corrosion of metal parts used into the prosthesis. So if you want to disinfect your prosthesis before delivery into the patient mouth, you can keep it into mouthwash or saline. Again, if you want to disinfect a denture, then you can use 4% chlorhexidine scrub for 15 seconds, followed by 3-minute contact time with chloride solution, which will be effective in decontaminating these dentures. So this is about infection control policies for lab work. So I hope it will be useful for you, as well as to prevent cross contamination from your clinic to the lab personnel. As I explained into the first video that what is the workflow for cross infection into the dental office, there was a one section that is a dental lab and dental office. I told that the purpose of infection control policy is to break that chain. So infection control of or disinfection of impression is an important procedure to break this chain between the dental office and dental lab. So guys, with this I am closing this topic. Thank you very much, and we will meet in our next video, which is on what should be the final action plan in our clinics after a lockdown period. So in that I am going to explain about what coronavirus, or what is the source of infection, how it spread, and what test we can utilize to evaluate asymptomatic carriers. And again there is a one more thing that I want to highlight in that video, that many people think that, or even the evidences have shown that coronavirus can kill those people who are aged or whose immunity is weak. But there is a one thing that I want to cover, that is called as a cytokine storm. So according to the concept of cytokine storm, I am going to explain you, if you are young, your immunity, your strong immunity is your asset, or it is your liability. So stay tuned with Fumident for the next video, which will be the final video, and in which we will discuss about the final action plan after lockdown while working on patient in dental clinic. And after that I am going to launch the final video in which we will cover whatever question I will receive from the dental practitioner or other people. So guys, suggestions and questions are always welcome, and if I am wrong somewhere within these videos, please raise a question so that I can correct myself or whatever informations I have provided. This is because whatever information I have provided, I have taken it from the particular guideline or I have taken it from some articles. So I am providing all the evidences, all the articles with this information in these videos, so that there should not be any confusion for any person. And if you are discussing with someone about these topics, you should have a proper concrete evidences for this information. So with this, I am concluding this video. Thank you very much.